Afternoon. My name is Jose Garcia. I am going to talk about Lyme disease complications. Definitions. Lyme disease is caused by four main species of bacteria, Borrelia burgdorferi and Borrelia majori, cause Lyme disease in the United States, while Borrelia aceli and Borrelia heyrini and the leading cause in Europe and Asia. The most common tick-borne illness in this region. Lyme disease is transmitted by the bite of an infected black-legged tick, commonly known as a deer tick.
Lyme disease affects the patient in many different ways. It depends on which stage of the disease we're looking at. In the first stage, the early stage that occurs about 7 to 10 days after a tick bite, Lyme disease affects the skin where the tick bit the person. The skin is infected with the bacteria and it causes a round or oval red skin lesion called erythema migrans. And that may or may not be associated with kind of flu-like symptoms like feeling flu-like, achy, chills, sweats, fatigue, malaise. And that combination of the skin lesion and those flu-like symptoms are the primary manifestations of the first stage of Lyme disease. If you don't treat the first stage of Lyme disease, then in many patients, probably more than half, the bacteria leaves the skin where it was initially inoculated and goes through the bloodstream to other areas of the body. And then the manifestations change because now other areas of the body are infected, primarily the nervous system, the joints, and the heart. And so those manifestations are different. If it affects the nervous system, it may cause what's called a Bell's palsy or a drooping face. It can cause meningitis with headache and stiff neck. And it can cause heart problems if the bacteria goes to the heart. Those heart problems are usually a slow heart rate that may cause the person to pass out or feel like they're going to pass out. The symptoms of second stage Lyme disease are probably often the most difficult to ascertain. They are symptoms such as fatigue, generalized achiness of the muscles and joints, and sometimes patients also know what they call brain fog type cognitive symptoms, where they have trouble with short-term memory and trouble multitasking. These symptoms, though, again, are not specific for Lyme disease and sometimes can make the diagnosis of second stage Lyme disease very difficult. Now, if we have objective signs such as facial palsy or heart abnormalities or meningitis, then we can more easily make the diagnosis of second stage Lyme disease. But in the absence of those outward manifestations of disease, relying on the symptoms alone is often problematic. Physicians may not think of second stage Lyme disease in somebody who has a fatigue or generalized achiness, and so we really have to think about it and then order the appropriate testing to make that diagnosis. The third stage doesn't occur for months or even years later, and that stage is called late Lyme arthritis. That's where a joint, usually a knee joint, swells up and has fluid accumulation and pain. And that's actually the way the disease was discovered in Lyme, Connecticut. It was an outbreak of joint arthritis in young children. So the symptoms vary a lot depending on what stage we're talking about.
Application in medicine. Any organ structure can be damaged, here liver, here joints. Symptoms: headaches, body aches. Treatment: doxycycline, amoxicillin, cefuroximine. Pros and cons. Prolonged doxycycline use in the first 72 hours prevents the development of the disease. Cons. Patients or while never damaged can take doxycycline. Side effects: diarrhea, sore mouth, itching of the rectum, and vagina.
December may not be the height of tick season, but experts say there's still a concern any time of the year because they can spread Lyme disease.
It can be a serious disease, and when that usually happens when the disease is not recognized. And when I said that sometimes there is no rash, the disease can progress without any treatment available, and that's when you see the complications of the disease.
One rare complication is a heart infection called Lyme carditis. A Centers for Disease Control report showed 3 people died from it. None were from New Jersey.
We do suspect that it is pretty rare, but given the tragedy of having young people die suddenly, we felt and still feel that it's very important to investigate them.
The 3 people who died are from Connecticut, Massachusetts, and New York State. They were relatively young, in their 20s and 30s, and none of them had been treated for Lyme disease. Experts say sometimes the symptoms aren't that severe or don't show up at all.
There are some infections where there is no rash. 20% may not have a rash. So the infection spreads throughout the whole body, and that's when, in the process of spreading, affects the joints, the heart, the central nervous system, by the way. You can also get meningitis from Lyme disease, and also affect the skin.
The CDC wants to raise awareness about Lyme carditis, but officials point out it is rare.
Lyme carditis among all patients that are reported to the CDC with Lyme disease is relatively rare. About 1% of patients who are reported to have Lyme disease have Lyme carditis. And we think that sudden cardiac death associated with Lyme carditis is even more rare.
Effective treatments are available for most cases of Lyme disease and other tick-borne illnesses, provided prompt medical care is sought from doctors who are familiar with the disease. There were more than 2,700 confirmed cases in New Jersey last year, and no deaths have been reported. People most at risk live or frequent wooded areas where ticks can get on your clothes. Experts recommend removing them with tweezers. In Montclair, I'm Desiree Taylor, NJTV News.
Use applicate in Ecuador. The American Academy of Neurology reported the first case of Lyme disease in Ecuador in a 20-year-old boy. Seeing else involvement is common: meningitis, cranial nerve palsies, neuropathies, encephalopathies. Careful diagnosis, clinical finding, laboratory, epidemiological studies are necessary to determine the occurrence of this condition in Ecuador. Conclusions. LACs recommend that patients with persistent symptoms and signals of Lyme disease be evaluated for other potential causes before instituting additional antibiotic therapy. LACs recommend against the use of a single 200 mg dose of doxycycline for the prevention of Lyme disease. LACs recommend antibiotic retreatment when a chronic Lyme infection in yet to be possible cause of the ongoing manifestations, and the patient has an impaired quality of life. Thank you.